Thank you so much for your time today, Dr. Arianna. It's so good to see you. It's been a while, actually, since we last caught up. So thank you for your time. Could you just start off by giving us a bit of a background about who you are, your training, your experience?
Yeah, thanks a lot for the invitation. And so my name is Arianna D'Angelo. I am a consultant in reproductive medicine and surgery. So primarily my area of interest is infertility and IVF treatments. I've been doing this for many years. I qualified originally in Italy and then moved 26 years ago to the United Kingdom, where I worked for many years in Wales. At the University Hospital of Wales, and there I completed my qualification as a consultant, and then I basically continued my career in Wales, where I became then the clinical director, person responsible for the IVF services, and eventually, I was managing all the satellite units in South and West Wales. But alongside that, my passion and main interest is academia, teaching and research. So I hold also an academic position with Cardiff University as a senior lecturer, and I've been teaching and supervising students for many years. The research side is also very important to me, so I've been always involved in that. From the very beginning, I was a research fellow, and then continuing doing research at international levels with collaborations with the European Society of Human Reproduction and Embryology. And I was actively involved in guidelines and papers, obviously, on the topic of infertility.
Amazing. Can I just ask you, what inspired you? Like, what sparked the interest for you to start thinking about relocating to the UAE?
Yeah, that's amazing questions, Emily. And I think you are part of the answer. Let me just clarify what I mean by that. As I said, I spent a long time working in the NHS. And at some point, I felt the need for a change. That actually happened for a number of years. And I've been in touch with you. You came across my network, obviously, many times I've been in touch. But it was never the right time, and eventually the time came that I wanted to really step out my area, my comfort zone, as we said, and then experience something new. So the idea was more like for me to see how I could do my job in a different environment. And also to try and improve my skills, my knowledge. There were some area of my specialty that I felt were not completely covered where I was. One of them is, for example, the genetic, that's quite advanced actually in UAE. And also the system in UAE is insurance-based and privately based, which is very different to the NHS. So I also wanted to explore that marketing side and put myself a little bit in a challenging position to see if I could succeed in a different environment. So these two were main drive, obviously. And then, the change in the environment, the lifestyle, which obviously is very attractive in UAE.
Yeah, amazing. How was the licensing process?
Yeah, the licensing actually, it was incredibly smooth. And I think I was thanks to your collaborators who well know actually how the system works. Yeah. So they were asking me the right documents at the right time, and they were dealing with all the little hurdles that you can get along the way. So the licensing wasn't a problem. And then, I had to undertake the exams, which for me was a little bit, uncomfortable in a way, because after this many years of experience, you kind of feel, oh, why do I have to take an exam? I am examining, but this is part of the adventure, and I think it's part of the experience. Yeah. And I felt my exams were more like a chat with my colleagues, my peers, really, more than an exam in its own. Okay, and so that was also a nice experience, actually. And now I'm examining the newcomers to get the license. So it is the way it is, and it did work well.
So Dr. Arianna, if you've got your family here with you now in Abu Dhabi, how's the transition been for your family?
Yeah, so this is still an emotional point for me to address, because when I came 3 years ago, obviously I had to take the decision whether to move the family with me or not to move the family and leave them in the UK. And this is, I think, a very common decision that anyone who's deciding to relocate to face, unfortunately. So at the time, because I didn't know what was ahead of me, really, I decided to leave my family in UK and then relocate or, start this journey alone, to see if it was, successful and if it was the place where I wanted to move my family eventually. So it took me around 3 years then to reach that point, because I have 3 children, as I said, and they are 3 years apart. So they were in different stages of their education in UK and academia as well. So the first child moved, and then after a year, the second child moved, so that she could fit in the education system at the right time, while she was transitioning from primary to secondary school and from GCSE to A levels. So this is the type of discussion that probably as a family it has to happen. But this could never have been possible without the help and support of my husband, of course. My husband's been instrumental in all of this, because he had to stay behind in UK with 3 children, 1 cat, who, by the way, was the first to relocate.
Of course.
Cat has priority. So my husband, he had to kind of deal with the family side while I was away, and now it's amazing that we are all reunited as a family together. And so it could take a little while, but eventually it did happen.
So now you're working in the government sector in Abu Dhabi with SEHA. How have you found the facilities, like with regards to, you need specific equipment, don't you, in the lab, and how's the resources been since your relocation?
Yeah, it's amazing. I mean, all the facilities in UAE are fabulous. And obviously, being in this specific area, which is the fertility treatment, we need state-of-the-art equipment, but also policies and procedures in place to make sure that, for example, we have the right air in the lab, the right cleaning in the theater, and so it's very important. So this safety and quality aspect are followed fantastic way. And I see also they have expanded and invested a lot into the genetic side. So we do lots of genetic testing, and we apply this genetic testing to the little embryos, and that requires obviously state-of-the-art equipment, laser, and training. So our my colleagues are amazing, really. They do miracles in the lab. I always say this is a baby factory, but it's fantastic, the job that we do, and then eventually pays back because we see our patients pregnant, and it's excellent.
So you've trained hundreds of doctors, students, throughout your career. Do you have the opportunity to still continue doing that here?
Yes. This is one of the things that I like most, actually, to pass my knowledge, and the juniors also, in terms of coaching and guiding them and taking decisions. So I'm very fortunate, because in SEHA we have obviously the training program for our resident. So I have the residents to train, and also very recently we got the accreditation for the fellowship in reproductive medicine and surgery, where I am a deputy program director. So we're gonna have fellows actually in fertility to train soon, and this is a very nice program which will run for the next 3 years, and hopefully, inshallah, longer than that. So there are always opportunities for teaching, and I'm still very much involved, obviously, with ultrasound teaching nationally, within UAE, but also in Europe with the European Society. So thank
you so much. And how was your experience working with Allocation Assist?
It's fabulous, fabulous. It's been very nice from start to end. Actually, there is no end because what I really amazing about you, Emily, and your colleagues and the agency is that you are always there. So even when the relocation completed, it took place, and I was, in my job, you still get in touch, and there is a lot of support. And I know that if there is anything I need or I doubt, there is a huge now network of colleagues, thanks to you and your agency, that we can rely with each other, and with some of them are friends now, became friends really. So it's more than the allocation that you do. Is actually building, friendship, relationship.
Thank you so much.